Hey detoxers, welcome to a special episode of the Disinfo Detox. Today we're talking about all things Tylenol and autism. I am joined by Anastasia Berg, who finished the PhD program in Biochemistry and Molecular Medicine at University of California, Davis. Anastasia, welcome to the Disinfo Detox.
Thank you, Nolan. Thanks for having me.
Yeah, it's a pleasure to have you here. And I guess we can just start things off. There was a pretty wild press conference on Monday from Donald Trump. And before we get into the weeds on this, what's your take on some of the things that were said there that stood out to you?
Yeah, it was an interesting press conference to say the least. Of course, our president mispronouncing acetaminophen stands out to most who watched. Um, I think what's interesting is, um, back in April this year, the CDC released data on autism and vaccines. And the data says that 1 in 31 kids in the US have an autism diagnosis, and that number has increased from the year 2000. And so RFK Jr. has, previously spent his career investigating autism and vaccines as a cause. And as the new health secretary of the US, he's really publicly committed to um, providing more answers to the public quickly. Now, the focus of the press conference was certainly the association between Tylenol and autism, which may have come as a surprise to a lot of people, including women who have taken Tylenol during pregnancy. As a former pregnant person, Tylenol is the singular medication that's considered safe for pregnancy. And when you have severe pain, fever, illness, it's a reliable medication that's safe for the fetus, and that's been proven after decades of clinical research.
Just to cut in there real quick, right? So, President Trump is now recommending that pregnant women do not use Tylenol, claiming that there's been a link between pregnant women using Tylenol and the child having autism. That comes from a preliminary study we're going to talk about here today. And now, certain drugs he's going to talk about that are forms of vitamin B. He's going to say can be used for treating autism as well. So that was like the big point of the announcement on Monday. But back to what you were saying about how the claims he's making are not really well supported.
Yeah, and it's interesting. President Trump really inflamed this issue in his press conference. RFK Jr. and the CDC are actually a little bit more measured in their messages to doctors and to the public. So what's coming out of the press conference is that the FDA is issuing a warning to physicians that acetaminophen is dangerous when taken by pregnant women because of this link to autism. And President Trump even went so far to say that women should fight like hell not to take it. But Tylenol is essentially the only pain reliever that's considered safe in pregnancy. And it's long been established as a safe pain reliever and fever reducer. It's been used since the late 1800s. It went on the market as Tylenol in the 1950s. And it's really the only non-NSAID pain reliever that a pregnant woman can rely on over the course of 9 months. And what's, I think, especially dangerous about this advisement from the president that women should just tough it out when they get sick and fight like hell not to take any medication. What's so dangerous about that is that when you don't treat, when a pregnant woman isn't treated for a medical condition that warrants the use of acetaminophen, like fever, pain, headaches, that can be really dangerous, not only for the woman, but for the fetus. And we know that when they're left untreated, some of these conditions can create, risk of harm or even, death to the fetus, as well as the pregnant person. We know that high fever has actually been associated with developmental defects and otherwise. So the long and the short is that fevers in pregnant women should not be left untreated. And ACOG, which is the American College of Obstetricians and Gynecologists, very clearly states that the research on acetaminophen is clear. It is safe for use in pregnant women, and sustaining a fever and not treating it is dangerous.
Let's kind of break this down. I want to be as fair as possible and not kind of out the gate attack this conclusion by just kind of, can you walk us through this? Is there any research that's at least like pointing in this direction, or research that's looked at this link between, the drug I can't pronounce, but we're going to call it Tylenol, and autism? Help us understand that.
Yeah, absolutely. So, the long and the short is that the research suggesting a link between autism spectrum disorder in children and the use of acetaminophen, you and our president alike couldn't name that. Acetaminophen, which is the generic for Tylenol, causes autism. The studies are relatively weak and primarily show a correlation between the two things as opposed to causation. And that's a really important element for us to discuss today, because it's commonly a problem with the public's interpretation of clinical research studies, right? It's very easy to assess the presence of a disorder and look for a root cause. But if the study is not properly controlled in order to evaluate true causation, we can sort of jump to conclusions. And that's what we're seeing here. That's what all the scientific experts have sort of already relayed about the government's assessment of this correlation between Tylenol and autism in children.
Yeah, and when you're saying that, right, with correlation, I saw a funny meme about this online that essentially, like, some percentage of people who eat pickles get cancer, and everybody who's eaten a pickle, before 1901 is dead. So pickles must be causing cancer and death, right? That's kind of the point you're making about how the lack of evidence to say that Tylenol is the singular cause of autism, right?
Yes, exactly. And there are a lot of examples that are given, sort of like your analogy. A common one is that ice cream sales and shark attacks increased during summer months. So that must mean that there's a causation there, right? But really, it's just a correlative relationship. It doesn't mean that eating ice cream causes shark attacks, of course. I mean, the average person could surmise that those two things are not linked. Both are independently influenced by warmer weather, but one does not influence the other. And so when we perform clinical studies, we need to control for all of the variables as much as we can in order to understand what's really underlying a condition. Alternatively, we know that smoking does cause lung cancer. There are myriad clinical studies that demonstrate this. So that's a direct cause and effect relationship. But ice cream consumption has nothing to do with shark attacks. So that's a nice example to really kind of parse out the difference between a correlation and a causation.
Yeah, can you talk a little bit about what we know about autism in terms of what it is and how we diagnose it? And if you can speak to this, I think it was President Trump, and I know it's certainly his supporters, we're making this claim that there's many places on Earth where autism doesn't exist, and so his conclusion is it must be pregnant women taking Tylenol here that are causing autism. But can you speak about what we know about autism, kind of its origins, what it is, and are there places on Earth where it doesn't exist for some reason that's of scientific interest?
So what do we know about autism? Autism spectrum disorder, it's how we define it today. It's kind of an umbrella term over a number of disorders that are related. It's a condition related to brain development. And it really impacts how people perceive and socialize with others. And so when I say spectrum, refers to kind of a wide range of symptoms and their severity. We have now grouped Asperger's syndrome and other developmental disorders in with autism. And those were once thought to be really distinct from each other. The disorders typically present very early in childhood, usually within the first year of life, though sometimes within 18 to 24 months. And in fact, some children can appear to be developing normally, and then they'll regress and they'll start showing signs of autism. Excuse me. There's currently no cure, but we know that early intervention, early treatment can make a difference in how children with autism socialize and interact with other people in their environments. And the diagnosis is sort of imprecise because of the variations in types of disorders and again severity. So diagnosis can involve anything from specialists like child psychiatrists or psychologists, pediatric neurologists. There's not one specific medical test. The diagnosis will typically include a variety of observational tests, tests of hearing or speech, communication, behavior in young children, as well as genetic testing. Again, we're understanding, we're better understanding with research that there's a strong genetic component underlying the onset of autism. But it can be really challenging to give a definitive diagnosis because the symptoms vary so widely. And I think that in part underlies as well some of the controversy around causation.
Yeah, and one of the things that we talk about in this program a lot is the ways in which kind of these baseless or false narratives shape the way that people look at information. And kind of closely related, I know you already talked about this with President Trump's claim about how there are groups like the Amish who he claims, have no history of autism. As you point out, that's easily refutable. But what about this similar claim that I've heard RFK Jr. make, and he's made this for years, that we didn't have case of autism prior to widespread vaccine use. So what do you say to that?
Yeah, that's absolutely false. And we have to look at how we've been diagnosing this disorder. So kind of relevant to what I was just saying. The way that we diagnose and we identify autism spectrum disorder has really evolved in recent years with kind of the amalgamation of other disorders, including Asperger's. We're transitioning from a time in which we diagnosed children with really extreme autism symptoms, really extreme behavioral disorders, to now understanding that it's a larger umbrella of diseases. So we have a lot of high functioning, highly intellectual children who also exhibit symptoms of autism. So really, it's not that autism never existed. Autism is now caused by vaccines. It's that we are identifying more children with autism disorder simply based on how we're defining it. And in fact, there was a study that looked at the increase in, and I apologize, I can't reference it exactly, but there was a study that looked at the increase in prevalence of autism disorder. And certainly that it's been increasing in the United States in recent decades. But at the same time, the prevalence of individuals with autism-like symptoms in the population was unchanged. So people have autism. We are just identifying more of them, essentially.
Yeah, and I don't mean to bring this up to beat a dead horse here again, but I think it's important context that this connection between Tylenol and autism follows a lengthy, I don't know what we call it, debate discussion about the connection between vaccines and autism. And this was a really interesting movement at the end of the 20th century that saw the far left and far right kind of come together around a skepticism of the medical establishment, Big Pharma in particular, which I'm a critic of Big Pharma as well, so I get that part of it. But my understanding is that there were some studies that did point to a connection between autism and vaccines, but then the scientific community came around to rejecting those studies. Can you kind of just explain to folks what happened there? Because I think that accepting of a study and rejecting of a study has played into a lot of skepticism for folks who may not understand the process of how it became a study and why it's rejected. Can you talk a little bit about that?
Yeah, absolutely. There's certainly been a lot of controversy over this topic. Um, uh, there's been sort of a controversy over whether aluminum in vaccines causes autism. This has been extensively studied, and while it's controversial, um, extensive safety studies have been performed on millions of children, showing that vaccines with aluminum adjuvants do not increase the likelihood of autism or other developmental disorders, and that the doses of aluminum salts in these vaccines are far below levels that would be toxic to humans. Large scale studies have demonstrated time and time again that vaccines do not cause autism, but smaller sort of studies demonstrating potentially a correlation between the two have been sort of latched onto by the far right. We also know that there's really not a single cause of autism. We know that autism can be the result of really complex interactions between genetic components, between the environment. It's well established that genetics and epigenetics, meaning factors that sort of control how our genes are expressed, can underlie autism. We've seen twin studies that show strong heritability, meaning that the genetics of two kids from the same mom, or that two kids from the same mom have a higher likelihood of both developing autism, which sort of indicates an underlying genetic component. And there is emerging research that certainly environmental factors like environmental toxins and pollutants can interact with genes that cause autism, and might be underlying some of the prevalence and increased autism rates in the United States.
You kind of alluded to this earlier, that the government is looking at some study. I believe you called it a preliminary study. Can you talk to us about what that study is? What does it mean to be a preliminary study, and why is it that you are not necessarily rejecting it, but you give it little weight? Can you explain why that is?
Yeah, so there are a couple of things here. First of all, when we talk about sort of the stringency of clinical studies, we have things called randomized controlled trials and observational studies. And typically, to show a causative relationship, we want to see a randomized controlled trial indicating that what we're studying is actually causing a certain disease state. Now, when we talk about acetaminophen use in pregnant women and autism spectrum disorder, we really can't perform randomized controlled trials on pregnant women. It's considered widely unethical, right? So if I were to execute a study looking at acetaminophen use in pregnant women and randomize a group of pregnant women to the acetaminophen group and conversely to a non-acetaminophen group, a control group, that would be considered unethical because we don't want to interfere with a woman's pregnancy or potential outcomes with that child, right? So kind of all pregnancy studies are sort of retrospective or behavioral studies. And so that's already a limitation when we talk about, the research that underlies acetaminophen use and
That's
risk.
that's really fascinating. So you're saying that in general, the scientific community is kind of limited in what they can do due to ethics when it comes to researching pregnant women?
Yeah, absolutely. And, you may have heard from the women in your life that it can be frustrating to be a pregnant woman because there's a lot of advice given by doctors and not all of it is data driven necessarily.
Mhm.
Even things like bed rest, alcohol consumption, those have all been debated. Is bed rest helpful for a pregnant woman? Or does it offer any benefits? Is it just a complete waste? Alcohol consumption, is one glass a week okay? Is 4 glasses too many? What's the threshold and what's really the mechanism?
Wow.
That alcohol is impacting fetal development. So this is kind of a common thread, and I think this discussion of acetaminophen falls right into it, and falls into a trend of women are kind of mother blaming in pregnancy.
Interesting. So, okay, when it comes to this preliminary study, what makes it preliminary? And let's start with that. First, what makes it preliminary?
Yeah, so I guess research studies can be considered preliminary if they're not well controlled, right? So if I'm evaluating, if we go back to our example of correlation versus causation, if I'm evaluating whether ice cream consumption increases shark attacks in the summer, I can look at the number of people eating ice cream in the summer and the number of shark attacks in the summer, right? And if those are increased, I can say one causes the other. But if I haven't controlled for things like the temperature, right, or other underlying factors that could drive each of those things, to go up independently, and that's a poorly controlled study, and we shouldn't make strong conclusions from it. And so when it comes to research studies, again, a randomized controlled trial is the gold standard, right? We want to control for as many other elements that could be, underlying a disease state. Certainly, we can perform, what are called retrospective studies, where we look at past data of patients with a particular condition, and we can try to control for the elements as much as possible to make a conclusion. We can perform behavioral or observational studies with sort of small cohorts of people. So, if we're talking about, some of these studies in question are of really small sample sizes, so we're not looking at a ton of people. To control for the variables well, we need to enroll a ton of patients into a research study, really in order to make a statistically significant conclusion on the numbers. So preliminary studies are often, studies looking at maybe a handful of patients, a couple dozen patients. And these sort of studies, observational studies, are valid, but we have to be careful. It's good to collect information. It's good to publish information and control for the variables in a study, regardless of how it's constructed, as well as we can. But we need to understand, the parameters of a study before we take the conclusion as fact.
I think one of the animating features of folks who believe there's a connection between autism and vaccines, or autism and Tylenol, is they have this conclusion that Big Pharma has used its money as a form of influence over the peer review process. So I wonder if you can kind of explain what the peer review process is, and then talk to us. Have you seen Big Pharma get involved in that? And even if you haven't, are there other problems with the peer review process? Can you just kind of talk us through that?
Absolutely, yes. I would say even in academia, there's a lot of distrust of, across academics, there's a lot of distrust of Big Pharma. And, if a lab is publishing an idea, will Big Pharma squash it or steal it to make more money? Certainly, I've seen that firsthand. I do not have experience with that firsthand. And I think that's a fear that has been excessively hyped up. I will say the peer review process has grown to be as grown to be as stringent as possible, but it has a lot of limitations. So typically, when you publish a paper, a group writes up a study, submits it to a journal of interest, and there are a lot of journals out there. And that if that article is accepted for review, the article will be sent out to a handful of reviewers in the field, people that are studying this material and can be really critical of the research and provide feedback. And based on those reviewer comments, the study can either be accepted, rejected, or there's sort of an in-between where the reviewer provides comments and additional experiments can be performed, adjustments to the manuscript can be made, and then the study, is resubmitted to the journal and is potentially accepted. And that's pretty consistent. That process is fairly consistent across journals. However, this concept of publish or perish has become pretty prevalent, at least in academia, where labs are struggling to publish abundantly in order to retain their funding. Graduate students are trying to publish in an increasingly competitive world in order to receive their degrees. And so that can put stress on, the accuracy of information in research studies. And then certainly there can be, competition amongst peer reviewers in the same space when it comes to, reviewing articles from a lab that's competing with their research. It's a challenging process. It's very time consuming to get an article published in a journal. And actually, different journals have different levels of prestige based on what's called an impact factor. So an impact factor is kind of a number assigned to a journal based on how many times their articles are referenced. And so there's sort of like a cycle of that, perpetuates top labs submitting to and publishing in top journals. And it can be a little bit of an unfair, challenging process.
Yeah, I mean, someone who's gone through it, not in the hard sciences like you. Yeah, it's pretty cumbersome, and I'm always amazed how like rarely they ask to see data. And I was bringing this up because I'm thinking of this study with Tylenol, and I'm not saying this is true about the Tylenol. I don't know this to be a fact, but it's very easy for a study to get quote unquote accepted and then rejected later on when it can't be replicated, right? That's a big thing and part of the field. Can you talk a little bit about that?
Yeah, absolutely. There is a push to perform um, sort of replication studies where another lab independently looks at the materials and methods of a study and tries to repeat the results. And it is astounding how uh, often labs are successful in doing that. There are a lot of factors that you have to control for when you perform studies, when you perform, experimental scientific studies. And the materials and methods section of a paper is supposed to relay to the reader how the research was done, right? And that should be provided in great detail. It isn't always. And kind of all of the factors in the experimental setup aren't always disclosed in a really obvious way. And so um, we're finding that research can be very hard to replicate, and that's kind of opening up um, I think larger issues with publishing. That's certainly true of basic science, translational science work, laboratory bench studies, but also true of clinical research. Right, we have to be really transparent in our methods.
Anastasia, as we wrap up here, it strikes me that there are a lot of probably mothers who are expecting, who are watching this news, and are probably confused, scared. I don't know. What advice do you have for them, if any?
Yeah, I think look at the data. It's so easy to hear a headline um, and you kind of run with the conclusion. My mom still sends me sort of clickbait articles every day on, the importance of blueberries for preventing cancer, or do these 5 things to prevent heart disease, or you know, this cleaning agent causes some disorder, and it's really easy to get scared by those headlines. But to the best of your ability, read the study or talk to a scientist, talk to someone knowledgeable who can help you evaluate the study itself. If we don't look at how the studies are set up, we need to be cautious to take the conclusions as fact. When it comes to pregnancy, I said it before in our discussion, but there is so much to be afraid of. Maternal anxiety is absolutely a thing. When women are pregnant, they're told to not do this and not do that, and it imparts a lot of fear that their sort of average behaviors are causing harm to the fetus. And we should be advising women on behaviors in pregnancy based on clear, robust data. And while randomized controlled trials are not possible in pregnant women, there is an abundance of data enrolling, cumulatively, thousands and thousands of patients that have indicated, that things like acetaminophen use for fever or pain is absolutely safe. And in fact, when there was a recent study that kind of further reinforced this. The Trump administration is referencing a review article of a bunch of studies that essentially shouldn't be amalgamated into a meta-analysis. There was a prominent study of Swedish children. It looked at over 2 million Swedish children and found initially very small associations between acetaminophen use in pregnancy and autism. But interestingly, these completely disappeared when they did sibling comparisons. So in these sibling kind of matched control studies that looked at siblings that were born from the same mother, they found that that correlation between Tylenol and autism completely went away. So the research absolutely shows that Tylenol is safe. We have known this. Understandably, this announcement, puts a seed of doubt in pregnant women. Um, there is ongoing research on the subject. I think that it's absolutely clear that vaccines have no causative relationship with autism. There is continued research in this field of, acetaminophen, impact on autism. But until we have larger studies and better data, there is no need to worry.
Anastasia Berg finished the PhD program in biochemistry and molecular medicine at University of California, Davis. It's been a pleasure talking to you and going through this stuff. Where can folks follow you and more of your work?
You can certainly Google me, look on my LinkedIn, look at my publications. I've worked previously um, in laboratory research and have moved into science communication roles. But certainly look at my papers, and you can make what you want of the impact factors of the journals that they're published in.
Hey, now they know what that is. All right. Anastasia Berg, thank you so much for coming on the Disinfo Detox.
Thank you so much, Nolan.
All right. Thank you, Detoxers. We'll see you next time.